Thank you, Andrea. Andrea Stedman Psycho is our amazing interpreter extraordinaire. And thank you for helping us practice language justice, Andrea. All right. Well, welcome to all of you. I am so excited to have you all join us here today. I am very excited to share the Bright Spots report that we've been working on for the past year. And I'm so excited that we have our team who are here today to join us and be a part of this. Yoni, do you mind sharing the presentations? We can get that started and get that up. All right. Couple of quick things. First of all, this meeting today is being recorded. And so please note that this is being recorded in both English and in Spanish. We will make sure to get this recording out to all of you, as well as everyone else who registered and wasn't able to join us in the meeting here today. Let us go ahead and go to the next slide. Thank you. I'm super excited about this project for several reasons, and super excited about our presentation here today. We have presenters who all worked on this Bright Spots project. We're going to allow them to present this work to you all. And as you can see here from the slide, we were very fortunate to have 7 FFN providers provide guidance and leadership on this project. And today we have us joining us today. We have Ana Elizabeth, Nabila, Shishi, Carmela, Olivia, and Christy. Unfortunately, I don't believe Almita is joining us today, correct? And so unfortunately, she's not able to be here, but we have most of our team here. We also have a couple of our lead researchers on the project, Hillary Fulton, Maria de los Angeles, Osorio Cooper, or Angeles, and of course, again, our amazing interpreter, Andrea. You'll also see our colleague, Yoni Doby Geffen, who's joining us today and has joined our team. He will be monitoring the chat and doing all things sort of tech related behind the scenes. If you have questions or things like that, please place those in the chat. We'll be monitoring those. Lastly, I just want to, we're a couple of things. One, I want to recognize that we also have a number of the actual bright spots that we're shining a light on at our meeting here today. So bright spots, thank you for joining us today. Thank you for being a part of this project. And thank you for allowing us to highlight the good work that you do. Lastly, I want to thank our funders of this project. I work for the Don L. K. Foundation. We are a funder of this project, but we also have the Buell Foundation. We also have the Colorado Health Foundation and the Colorado Gives Foundation. So 4 foundations came together to support this project, and you can see those logos there. Before I turn it over to Hillary, I just want to say that what I love about this project and this work is that we are attempting to shine a light on what's working. There are a number of great reports out there. There's been work done to date, and we're highlighting in many of those other pieces of work things that are needed to better support FFN providers. In many of those other reports, we're highlighting some of the things that we are missing and things that we can do better to support FFN providers. All of that is valid and important. For this project, we really wanted to shine a light on bright spots of FFN care, that it's happening right now, that's been happening for years in many cases, to support FFN providers, family, friend, and neighbor caregivers throughout the state of Colorado. I'll stop there because I think I'm stealing a little bit of Hillary's thunder. I'm so sorry, Hillary. I'm going to turn it over to you. Please take the mic. And again, welcome to you all. Thank you for being here today. I'm super excited.
Thank you, Miguel. And good morning, everyone. I am Hillary Fulton. I am with Hopeful Consulting, and I have had the privilege of shepherding this amazing group of collaborative funders, Bright Spots staff and FFNs, and of course, our family, friend, and neighbor co-researchers who you'll be hearing from today. Um, we have been working over the last year, and like we're going to be learning more about today, really learning to listen to one another, to build relationships, and to just center the care and possibility that we really have in working in this space. Our goals for today are to give you a little glimpse of what we have been learning. We want to share highlights from each of the 6 bright spots and share kind of the findings that we see across those sites. We will touch in just briefly on recommendations. We really hope to spark your interest so that you will go to the report and find the set of recommendations that's most relevant for you. And finally, we want to make sure that you know how to get connected to this work. If you're interested in taking action on what you learned in any way, there will be multiple ways for you to plug in, and we are excited to stay connected with you on that. This room is filled with report contributors, advocates, visionaries, and creative leaders who are really passionate about Colorado's caregivers, our young children and families. And I'm excited to see where we can go together. Before we dig into the report, I want to share a little bit more about what makes this report different. Miguel did steal my thunder a little bit on this one, but um, we really thought hard and worked to integrate FFN leadership at every step of the way. And today you're going to hear from 6 of the 7 co-researchers who helped from the beginning shape our research questions, conducted interviews and focus groups and observations at each of the bright spots. And not only that, they spent hours analyzing the data that came from that, and all of their effort has led to the findings and the recommendations we're sharing with you today. Miguel also touched on this piece. Thank you, Miguel, but it is important to share. We are at a time where we have more information than we ever have about family, friend, and neighbor caregivers in Colorado. A lot of the work that has been done elevates in an important way the gaps and our missed opportunities. And this report is going to focus on what is going well. Um, we feel that this is an opportunity to show what's possible and where we can go. And our hope is that it inspires you in your own communities to even more action. Finally, this report is a little different in that we are really thinking about multiple audiences. Um, Certainly, we hope that this is valuable to family, friend, and neighbor caregivers out there who are advocates themselves or who are interested in how they can tap in more into working in the space of finding supports and engaging with them. But we also are really thinking about community-based organizations that can reflect on what Bright Spots are doing and how they might integrate it into their work. We are um, looking at policymakers and funders. And we believe that if we can just all work together on this and figure out our own piece of the puzzle and how we elevate FFN voice and bring more supports to the table, we have a great opportunity for impact together. So I'm going to turn this over now to my colleague Angeles, who will give us a little more context as we jump into our findings.
In Colorado, many families trust the care of families, friends, and neighbors, FFNs, to raise their little ones. I'm sorry, I'm gonna try to adjust my microphone because I think that you can hear me well. Okay, what I was saying is that many families rely on FFN care, especially when there are not many options. In 2022, we knew that 94,000 children didn't have a space to attend licensed childcare centers. Among other things, this has increased the demand of care for FFNs. And these type of cares provides care for over 60% of the children in the United States. And it's still a vital care, but invisible and with little systemic support. Next slide. When we're talking about FFNs, we're talking about family, friends, and neighbors who are taking care of children. I'm sorry, Johnny, the previous one. We talk about family, friends, and neighbors who are taking care of children from their own homes. And in its majority, they are women and they do it because of love, commitment, and not because of pay. We could be talking about a grandma who is taking care of their grandbabies when their parents work, or a neighbor who opens their doors to take care of the children, or a mom who take care of their own kid and the kids of their neighbors. We know them by very different names: grandmas, grandpas, tias, uncles, aunties, salas, tetes, vivis, comadres, and amigas, and trusted people. These type of trust, that type of care is relying on trust. In Colorado, it is legal to provide care without license if you're taking care of a reduced number of children under certain conditions. And many families prefer FFN care because it is flexible, affordable. It provides an environment that is family, linguistically, culturally oriented, and the children are with people who knows them. Many providers, many FFN providers speak Spanish, Arabic, Dari, or indigenous languages, and they share the same roots with the families who they support. Although they're very important, current policies only support licensed providers, and these leave FFNs with limited access to resources without formal income compensation. And sometimes it really leaves them socially isolated, especially if they're immigrants or they live in rural areas. Next slide. The Bright Spots project was born of a joint dream. If you want to transform the childcare system, we need to learn directly from the providers who are doing this work daily and from the organizations who have walked alongside them. From the start, we collected information from key people, like people from the early childhood department, community organization, state leaders, and of course from the providers. As leader was saying, we had a team of 11 people, including 7 providers who participated as co-researchers for 8 months. Two or three researchers and one interpreter and one amazing person coming from the philanthropic world. We included different cultures and trajectories. Between all of us, we spoke 4 languages, and we come from countries like Colombia, Kenya, Mexico, Lebanon, and the United States. Next slide. In this project, we had a main question: who are already supporting FFM providers in an effective way? And what can we learn from their experience? We spoke with FFN leaders and institutional representatives in the whole state who share programs and practices that they consider promising. Based on their recommendations, we created some criteria to select 6 initiatives to study. And that's how the bright spots were born. Our goals were to document the origin of the organizations and how these programs worked on, and also to reflect on the different factors that allowed the FFNs to continue developing themselves personally and professionally. We adopted this participatory research focus. And what this meant is that our core researchers were a part of every single stage of the process. And we did 23 interviews with directors, staff in the program, over 13 hours of observation of different activities in the organizations, and participatory activities like photo voice, focus groups with 42 FFM providers. And this project aligns with national efforts to recognize childcare providers, FFNs, as a community vital resource, not as a second grade care. By highlighting the FFN research, we want to open doors of collaboration and structural change. And now I'm going to pass it to Carmela, so that she can talk to us about the first bright spot. Thank you. Thank you so much, Angeles. My name is Carmela Enriquez, and I have been a childcare provider for almost 21 years. It was a pleasure for me to be a part of this study to recognize and identify the bright spots. I hope that thanks to the information you're about to hear today, it will be a good start for many providers who do not know where to find resources and support so that they know where to turn to, and for these bright spots to receive more than the recognition they deserve, but also funding to continue the great work they already do. With that said, I have the pleasure and honor of introducing the Bright Spots, the Colorado Statewide Parent Coalition. The Parents Coalition was founded in 1980 to support Latino families in advocating for their children's education and ensuring access to quality education from an early age. Next slide. The coalition is a bright spot for several reasons, including being a pioneer in recognizing the importance of FFN care. In 2006, they realized that the majority of children in the Denver area were not attending formal childcare centers, but were instead cared for by families, friends, and neighbors. For these and other reasons, they created the PASO program, which I took, and thanks to which many FFNs like me were able to acquire tools to take our child care to the next level. I started PASO in 2013. At that time, I was caring for up to 7 children. After taking PASO, the PASO program, I realized it was better to care for fewer children. PASO gave me the tools I needed to offer higher quality childcare because their curriculum includes lessons on how to teach children in a fun way without. And also, they teach us that we need to have training like CPR and medication administration. What I just said and much more is what the PASO program offers. And and now I'm going to pass it to my colleague Christy.
Thank you, Carmela. Hi, everyone. I'm Christy Weber, and I'm here in Aurora, Colorado. I have been a nanny, a licensed childcare provider, and now I'm an FFN and a mother to two. So I'm really excited to share with you a little bit about what we learned from our next bright spot, the Early Childhood Council of Yuma, Washington, and Kit Carson counties. This council is one of 35 early childhood councils across Colorado, and this bright spot has been serving FFN since 2020. Next slide, thank you. If I can ask you to remember one thing about this bright spot, it's their ability to pivot. They recognized that providers in their community were largely FFNs, and they knew they needed to find a way to support them. Through the support of their funders and the extraordinary ability to remain tapped into the community needs, they began prioritizing supporting all childcare providers, so both licensed and FFNs. The council hired a coordinator for the FFN program, and I know she's on, so thank you for joining. She's a local community member there. She's bilingual, and she does monthly home visits where she brings developmentally appropriate materials and trainings to FFNs. But they don't just bring materials, they actually focus on how providers can interact with the children. So she shows the providers how to interact with the materials and the children, and how to use eye contact when you're teaching children, and so much more. One thing that we heard from providers in this area is how much they value those visits and also the materials. A big hit was a welcome wagon, which was like a literal wagon for the children filled with learning materials. And a lot of the providers expressed that they started using it like immediately. They started using it for walks and excursions. So these are very useful visits and materials. Through their innovative strategies for recruitment and community building, they now serve as a model for other councils in Colorado. Two things I want to quickly highlight. One is they created a quarterly play group for FFNs and the children they care for to connect and build their networks. They also offer a $25 Amazon referral gift card for FFNs who refer other FFNs to the council, so they're continually building their group. Another highlight is that the council has strong community partnerships with many local other organizations, such as the Rural Communities Resource Center. And they help FFNs and other community members with food programs, food banks, summer activities, and much more. The RCRC's goal has always been to bridge any gaps in access to service to better the lives and individuals in the community. And lastly, the council, in collaboration with several other local orgs, hosts early childhood wellness fairs. And at each fair, vision, hearing, dental, and developmental screenings are offered for children from birth to 5 years old. And they're offered in both English and Spanish. And in June of 2023, we learned through meeting with this Bright Spot that 53 children were screened at these fairs and 17 were referred as a result of the screenings. So community partners set up booths at the fairs to provide resources and to make connections with families in their communities. To be honest, it was hard to find just 4 minutes worth of what I could talk about with this Bright Spot because they're so amazing. They do so much more than I touched on. They have so many community partners that they keep up with, and they center FFNs and value them and continually think about how they can support them. So now I'll hand it over to my teammate Nabila to talk about our next Bright Spot.
Thank you, Christy. My name is Nabila Shahab, and I have been in the United States for 16 years now. And since I moved here to the US, I was trying to look for a job, and then I find out that the best place is to work with children. But at that time, I didn't know that if I want to run a business, like take care of children from my home, what the requirement. Everyone was telling me that you can't have it, you must be licensed. So that scared me. And I was like, oh no, I have to look for something else. So I decided to go for licensing, and I did work in many different centers till I find the empowering community globally, and which I'm kind of presented to you today. The ECG, it's the name, ECG, has supported families internationally for 41 years around all the world, from Palestine, Pakistan, everywhere. I can't remember the others, but they have been for 41 years. they established a programming for family, friends, neighbors as caregiver in the US. In Colorado, especially 2019, they did invest resources to help immigrants and refugees women to start their journey in the US as caregivers. One of the resources that they were looking to help them go through trainings using the PDIS, which is Colorado Shine system. It's a website that where they can look for the training to help them start taking care of the kids. They did work on translating the trainings to them. They will sit with each one, they do it one-on-one at the library, or they can meet anywhere. It works for the ladies. They invested. I'm so thankful to be a part of ECG. In my experience, having someone that speaks the language of my heart, in my case, it's Arabic, makes me feel valued and supported. Because, as a refugee or an immigrant moving from different environment to a new environment, it was really hard to start speaking and writing in English. So what they did, they enrolled us in classes, English classes, to help us communicate. And as much as they can, they will have interpretation for us to help build our journey. In my experience and other women experience, that will show us how they care about our language and our culture and what we bring to the table. For FFN working with ECG feel encouraged to communicate in the language that makes a difference for us. It encouraged me to also, as I mentioned before, to learn the language English, and to be able to access all the trainings in English, so that I and others can advocate ourselves. I will pass it to Carmela. No, no,
Ellie.
thank you. To Ellie, sorry.
Thank you so much, Nabila. Hi, everybody. My name is Ellie Chavez. I am in Fort Collins. I've been taking care of children since 2018. And I want to thank everyone for being here and everyone from the Bright Spots Project for giving me the opportunity to be part of this hopeful project. In 2019, the founders of the Good Food Collective in Durango, Colorado, recognize that food systems are essential mechanisms for addressing rural poverty, creating meaningful jobs, honoring cultural identities, and building strong and connected communities. The Good Food Collective understands that food security is an indispensable prerequisite for good health and civic participation. They understand that it is difficult for people who want to participate or get involved in the social, political, and economic life of their communities if they don't have food security. And now I want to introduce our Bright Spots, the Good Food Collective. And why is the Good Food Collective a bright spot? A bright spot. And where to start? I could say many things like it's bicultural nature, um, its food security approach, their starting point. That's the starting point, the food security approach. And it brings the community together in a single space. But what really brings people is their civic participation. Through their work, they create or they understand the intrinsic connection between food, housing, and childcare. They found a unique strategy called Duo. They empower the providers and they join them through their growth process. And on the other hand, they teach those in position of powers how to interact with multicultural people. And FFNs are changing the public financing and transforming the institutional behavior, helping these systems to be in tune with the priorities of the FFN community. This work led the collective to adopt an intersectional approach, reducing cultural barriers, and promotes collaboration between different actors to jointly address the structural causes. This organization shows the commitment with the community and with the FFNs in general. Their work is more than provide direct assistance because they really focus on reinventing the systems to shape opportunities of civic participation and economic stability. The Good Food Collective invests in the leadership of each FFN so they can take the reins and influence in the policies and decisions that affect their lives. And I want to close this presentation about the Good Food Collective saying that any person joining them will feel that they're being welcomed with open arms. And I'm going to pass it to my next colleague, Shishi.
Thank you, Ellie. Hi, everyone. My name is Shishi Shen, and I'm from China. And right now, I live in Boulder County in Colorado. I am a mother of 2 boys, and usually I care for 4 boys in my house. I am a FFM provider since 2020, and it is my great honor, my pleasure to be a part of this Bright Spots team and do the research to help and support and serve Africans better. And I'm here to introduce one of the bright spots I visited last fall. It is La Panda. And the La Panda, when I think about La Panda and I immediately think about that is a big celebration in community. And that was exactly what I saw when I entered into their classroom last fall. You know, when I walked into their classroom, I saw a big, bright welcome sign on the wall, and nobody will miss that. And I saw the special made name tags on the table with all the children, the parents, and along with a birthday child crown on the table. And I was thinking, what was that for? What is that for? And then before all the families arrive, I see the facilitators, they really work hard to check every single details. And then they open their door, welcome all the families, everybody walking, they hug, they laugh, they talk to each other. And I was thinking, they really know each other, and La Panda is such a strong bind community. And well, as I mentioned earlier, that each one of them have their own special name tag. And I noticed that there was a 3-month-old baby was sleeping in the stroller, and even that baby, he had his own special name tag. And I feel like La Panda really sees people and values people. And I remember the directors of La Panda, Lupita and Blanca, they kept mentioning to us, they said, they are families, they are people, they are not numbers. And the La Panda really poured out love and compassion to all the FFNs in their community. And I see that La Panda really offer practical help and support to the FFNs. They not only offer the local resources to them, and they also have the employment programs, facilitator system, and they even have the librarians come to their classroom to offer free programs from the local libraries and give the Spanish story time in their classroom. La Panda really believed that each house, every house is a classroom. So they are so passionate to promote early childhood education and really teach the FFNs the important milestones of early childhood development to them. They teach them the skills and knowledge to care for the children in their house, and that they see LaPenta really see FFN's values and respect their work. And with all that positive and impactful things I just said about LaPenta, you will see that that is really why LaPenta become one of the bright spots. Thank you. And now I'm going to pass to my colleague, Olivia.
Thank you, Shishi. Hi, good afternoon, everybody. Next slide. My name is Olivia Hernandez. 11 years ago, I started my career to be an FFN, a childcare provider at home. And I want to share that I feel very honored of being a researcher of the bright spots. Today, I'm going to talk to you about United Way of Weld County. I remember that when we arrived to the place, they were teaching the PASO program, and I felt like I wanted to cry when I listened to the students and the facilitators. I also had very positive memories that have been key for me as a provider. I also remember from the first class, they made me feel that I was able to learn to be able to offer a quality care in every single aspect. I also found colleagues and we're still friends. United Way of Weld County hosts the Early Childhood Council of Weld County. And together they have a local vision and local voice. And they work together to build a coordinated system of support for young children. Starting in 2009, United Way of Weld County adapted the Colorado State Parent Coalition's PASO program to offer it to family, friend, and neighbors providers, FFNs, in rural areas. United Way of Weld County, why is it a bright spot? So, speaking about the organization, United Way of Weld County, they help transform the lives of the providers in a personal level and in a professional level. The organization provides the necessary tools for childhood care. Okay, it's a little frozen, but from classes for literacy and financial scholarships. And they connect FFNs with other resources for the development of the children. And those resources can be shared with other families. In 2017, I was part of the PASO program. And from that moment on, I've always known that they accompany me for my well being as a provider. And I can say that they have transformed my life to help my own children and really appreciate the importance of taking care of children around me. Thank you so much. And I'm going to pass it to to Angeles or Shishi, I think.
Yeah, thank you. I will take the next part. Well, as we heard the brief instructions of the 6 bright spots, we can tell that these organizations really go beyond providing resources to their FFM providers. They not only promote early childhood education, but they also equip their FFM providers to lead, to shape the systems that impact their lives so they can offer high quality child care services. And following are the 5 key findings, and we concluded for these 6 bright spots. And my colleagues will expanding these findings one by one. And I will let Camila take the next part for the first finding. Thank you.
Thank you, Okay, the first finding was that trust and belonging matter. Among the things we learn, we have this lesson. Bright spots create welcoming spaces where FFN providers feel welcome because they make sure to emphasize that it's okay to use our language and culture. This is seen as a positive thing, not as a barrier. I was incredibly pleased to speak with the providers who took part of the PASO training with the Colorado Statewide Parent Coalition because they all mentioned that the teachers in Paso make them feel part of the great team they have, empowering them to continue their education and also advocate for childcare, guiding them through the process. And it is because of that sense of belonging and trust that they recommend the work that they do in the coalition even more. Now I'm going to pass it to my colleague Olivia. Thank you, Carmen. I am going to talk to you about what we learn with our second finding. Affirming dignity builds confidence in yourself. The organizations that we're talking about today helps us recognize our value as providers, as integral members of the early childhood workforce, and to feel proud of the work that we do through their accompaniment, investment of time and funds. They value us as important members of the community. Thank you, and I'm going to pass it to my colleague. Hi, thank you. And the third spot or the third point, we learn that guidance overcome barriers. Each of the bright spots guarantees the training and support necessary for high quality FFN care. As we know, there are many learning opportunities and resources available for FFN providers, from training in child development and business practices to creating early learning materials and financial assistance. But oftentimes, accessing them is not easily available, either because they don't reach the right people or because they require tools and technology that they're not accessible or that they don't have the knowledge, and language remains a barrier. The bright spots overcome these limitations by breaking down barriers, ensuring that essential resources and training are accessible to all who need them. And finally, the bright spots demonstrate their commitment to language justice, which defends the right of every person to communicate, understand, and be understood in the language that allows them to express themselves eloquently and in which they have the greater decision making power. And now I'm going to pass it to my next colleague.
Yeah, thanks, Ellie. Um, our fourth key finding is really in line with what our first 3 key findings are, but kind of takes it one step further. So, advocacy fuels change. In a number of our bright spots, they were able to sustainably support FFNs and keep a high level of engagement because they were supporting advocating for systems and policy change. In our interview with Rachel Landis, she's the leader of the Good Food Collective, she quoted, "Nothing about us without us." And they have a deep belief and practice that the stakeholders, the people working with the organization, um, the experts in whatever that sector are the people that should lead, identify the challenges, and identify the solutions. So when we were interviewing with Rachel, that really stuck with us. And this is also where we see the idea of accompanimento. And the idea of, I think about it, it means like hand in hand, like you're guiding somebody or somebody's guiding you or you're walking the path together. The bright spots that are they're supporting FFNs and working hand in hand, they're elevating the voices of the community members who may not otherwise be heard. And they're supporting them in the short and long-term goals of their advocacy work. And now I'll hand it over to Hillary.
Okay, the fifth finding we want to share more about comes from our reflections of just the leadership, the bold leadership of the organizations that we were working with. We certainly heard along the way, this is possible. And beyond that, this is essential. And beyond that, this is worthwhile. But I will say, nobody said it was easy. And so we want to underscore that doing this work really takes creativity and resilience, but the innovation is possible. And so we are excited to really explore more how leaders are demonstrating their ingenuity and drive and overcoming many of the challenges that are associated with this work. We want to celebrate their dedication and their sheer determination. In many cases, these communities have been working against some really common assumptions that diminish the value of FFNs. They have pieced together a patchwork of short-term funding that helps make the work possible. They have developed entirely new ways of finding and engaging with caregivers in their communities, and they have forged new and creative partnerships to make it work. So this work is not for the faint of heart, but it is work that can and must be done. Today we have just a small amount of time to give you a glimpse into the report's recommendations. These are rooted in what we learned from the experiences of Bright Spot staff and the FFNs in their orbit. They are shared with you through the lens of the lived experiences of the co-researchers that you've heard from today. And it really incorporates wisdom from so many perspectives. So, as I shared with you at the start of the meeting, we have three main categories of people that we are speaking to through our report's recommendations. The first are community-based organizations. So, among the bright spots you heard about, we had 2 early childhood councils who have explored doing this work in different ways. We also had several nonprofit 501c3 organizations that were serving as bright spots. We know that in different communities across the state, there will be different organizations who might be best positioned to take up this banner and really support the caregivers of young children in their communities. So I think the common theme here is how can you really put the FFN caregivers in your community in the center of your considerations? How can you create welcoming environments like the ones that you've heard about through the presentation today? We are excited to have recommendations that give ideas about addressing barriers to having access to resources and professional development and other professional growth opportunities. And we want to make sure that all of the community-based organizations who can recognize the value of FFN caregivers and support their leadership. And not only that, pair their recognition of value with advocating for and helping make pathways for financial stability, whether that's through financial assistance or through creative models for increasing compensation. We also just want to encourage communities to think about the whole picture of caregivers in your community and where young children spend their days and how you can kind of work across lines of licensed care and license exempt caregivers to make sure everyone has the supports they need to deliver the high quality care that's possible. We also want to speak today to policymakers. Many of you are here, advocates are in the room, and we are so grateful for that. A lot of our recommendations in this area kind of mirror what you heard me talking about for community-based nonprofits. How can you really think about your policy development, whether it's a rule or a law, and integrate family, friend, and neighbor caregivers and the organizations that support them in decision making? This will go so far in making sure that you're not solely focused on access, but you're really thinking about, or I'm sorry, you're not just focused on eligibility or something being available out there in the atmosphere, but you're thinking about access and the ways in which people can truly connect with what you're putting forward on the policy stage. Language comes across throughout all of our sites as being just central to making sure people can really find and connect with and benefit from what's available. So considering language justice across the board is so important. And I think we are happy in the report to discuss this with some nuance, because we know it's not just a matter of having a document in a particular language, but it's really about thinking about the whole culture and sharing information in person if that's the way people best learn, and really understanding the community you're trying to work with. And so from a policy standpoint, thinking about that in your design and how you think about funding your work. We also really have taken the opportunity to make some connections across related issues that are very pressing in communities. You know, we understand that childcare is kind of gives the whole community life. People cannot go to work if they do not have care that they can rely on. And businesses, by extension, cannot be successful without childcare. And the connections go on and on. And so we just really invite you to think about your cross-sector partners and how to take a big picture view as you consider your engagement and support for our family, friend, and neighbor care. We also have a very specific recommendation around our child care assistance program in Colorado and ways that communities can think about equitable pay there. If you have only a few licensed childcare providers in your community and you have a resource that you can make meaningfully available for families to afford their care, please consider doing that. All right. Finally, as I'm using up some of the luxurious time that was left over from our earlier parts of the presentation, I want to speak to funders. Many of the funders who are present here today are already committed to supporting family, friend, and neighbor care. We want to encourage you to stay at the table, to do what I was talking about. Think about your other intersecting interest areas and ways that you can coordinate and bring more resources to the table in support of family, friend, and neighbor childcare. We know that Colorado's Early Childhood Council network is really well positioned to help change the culture in communities across the state to think more inclusively about family, friend, and neighbor care. And funding incentives will help, because so much of the funding, both for councils and for nonprofits, is quite restricted and short term. So a huge recommendation from our group is a consideration to funders that we really make funding more stable for the long term. Building relationship and community and starting new work is not something that can happen overnight or in 1 year. And having that consistency is very important. And to carry forward the strand of language justice, it costs more than it does to have things only available in English. And so we ask that you really think about that and encourage your organizations that you fund to also really consider their strategies and what funding it will take to deliver their programs to people who speak languages other than English. And finally, think about how you can really strengthen and bolster this sector through strategies to boost compensation. Funders have the ability to take risks, to be innovative, and this is a real need and opportunity that you can pick up. All right, you all, there is so much that you can find in the reports around these recommendations. And we implore you to go there. You will see more examples from each of the bright spots that help illuminate the recommendations as well. So please, after today, don't miss that opportunity to spend some time there and reflect on, how you might be part of the potential impact we can have together. I believe we now have a chance to speak together. I'm going to pass it to Carmela, who will facilitate a discussion among us. We're very interested in where you'd like to go next.
Thank you, Hilary. Now, we would like to invite you to a group discussion. We ask you to take a minute or two to reflect on the following questions. What finding or recommendation caught your attention the most? And what have you been curious about? In other words, what would you like to know more about? We're going to take a couple of minutes to share your answers. You can share your answers by opening your microphone, or if you prefer, you can post them in the chat.
Thank you, Carmela. I will now present with Christy the section about the changing the narrative. If we go,
Nabila, well,
yes,
we're allowing a little bit of space for people to share any questions before we start. You're great. There was a big pause for you to step into. Don't worry. We just want to give a little bit of room for some discussion. You all, we have, I think, 15 minutes available for this. And so this might be your main chance to talk to all of the researchers at the same time, even though we hope we'll have more opportunities down the line. So please do chime in with things you're interested in or ideas you want to share.
I wanted to invite Milagros.
I have a question. I'm sorry. I'm sweeping over here because I was done taking care of my children, of the children I care for. I have a question. This research that you did you do this research with Latinas, immigrants, FFNs? Hi, Millie. Yes, Millie, we spoke with women, FFN women, Latinas, immigrants with different status, like different immigration status.
Millie, you also shared a comment in the chat. Did you want to share more about your observation about the experience of some of the FFN providers?
Yes, I will repeat. And hi, my name is Milagro Chavez. I'm an FFN. I take care of children during the weekend. And there's something that I'm asking, like in all of these that you're talking about, like I just have a wondering. I'm really grateful that you're here working on all of these very important things, which are the children and the women caring for those children. But my question is, Many times we care for children, and these families are immigrants, and they only work like 1 or 2 times a week. And so we go to the food banks so that we can bring food to these children. How do we ask these women? Like, I don't ask them for money when I take care of their children. And that's why I'm only doing it Friday, Saturday, Sunday. And okay, I did it today as well. But how am I going to ask these women for money when I know that they're working 1 or 2 times per week and I know that they don't even have enough money for food? So, was this study done with Latino immigrant women? Have you heard their stories, like the stories of the family, parents of the children, and the story of the FFN who is also an immigrant? And my other question is, I have my CDA and I took the PASO program. And when I took the PASO program, they told me, you're going to do this and that. And everything was happiness, right? But when I was done, when I finished with PASO and then I got my CDA, it was a lot of effort. And I'm very grateful with CSPC. But in like I crashed against the world. At that moment, I learned that my CDA was only good if I was in my own home. And my apartment is very tiny. My apartment was a 1 bedroom apartment at that point. And I was thinking, okay, and now what am I going to do? Where am I going to have the children? I didn't know about any of that. And when I went to get a license, I said, well, now I can now I can't get my license because of the apartment that I live in, because I also have a child that is not 18 yet. I don't know. At that point, I felt very frustrated. And I just started thinking, wow, all of these women like me who started thinking about this dream, and then we just crash against this brick wall, which is reality. But nobody told us the truth when we started this work or when we started doing this. And so I guess that was one of my questions. I am very grateful that you're thinking about this. But for me, it is important because I'm inside of that percentage of people that I'm talking to you about. So for me, it is important to tell you, have you talked to immigrant FFNs, Latina FFNs, or from other countries? Have you asked them? Have you gone to a childcare place in a community that is not wealthy? And have you gone and have you talked to the person and have said, like, how do you do it? How do you make these happen? Because that's the value of our information, and that's what I think. That's what I wanted to share with you all. Thank you. Thank you, Millie. You're asking very good questions. And these questions, you can see them in the study. These were themes that were difficult, were topics that were difficult, and we share with the bright spots about them. These are topics that we continue exploring. These are topics that we continue talking about. And certainly in this study, we wanted to focus in what was working well, what was what was successful, without ignoring the importance of the topic you're talking about. But the idea of the study, this report, is to share what we learn, including ideas that are very creative, and they have created all of these to be able to talk about what is the intersection, what is the relationship between the childcare and what you're talking about. For example, affordable housing. Because as you were saying, a single woman or a woman alone who is immigrant, who is taking care of children, how can you access housing so that you can also have your own business? Emily, we don't have a lot of time. I can talk more about this right now. I know that it is very important, but I just wanted to say that very, very quickly, and we can connect later and talk more in depth. And for other people, just so you know, in the report, we talk a little bit more about how the organizations are looking at these themes and are finding creative solutions. Anything else you would like to add, Millie? No, Angeles, thank you so much. I know that sometimes because of this schedule, we can be present. And I know that I'm a little difficult with all of these topics, but for me, it is important because I know and I understand that you're doing a lot of positive things. But for me, it is important to let you know what is happening with my community. Um, and to tell you when I'm talking with my colleagues and with new people that are coming out of the PASO program, to tell you what they are experiencing in this moment and the way that they feel. And I think that I've shared this with you before as well. That's what I wanted to share. And thank you, thank you, thank you for allowing me to share here now.
Your input is so welcome. And in the report, you'll see we have heard that story, like Anjali said, and it's something we need to all work around together. I see a few hands up. I would love to invite Mary.
Hi, good afternoon. I wanted to say that I feel very identified with Milagros because that's just how frustrated I am right now. I'm just as frustrated. You are invited, and then we're going to study, we're going to get something, and they show you that everything is going to be beautiful, it's going to be wonderful. Oh, and you're going to do great, and you're going to take care of lots of children. I'm in the same situation. I'm taking care of two little ones right now. I am not charging for this work, but you do, yeah, you do crash against the brick wall because no, it's not true everything that they tell you regarding childcare. And I'm only talking about the place that I went to school, and I went to the same place that Milagros went. And you feel very frustrated, a lot, very frustrated, because you can't really do much. And I I was saying that it wasn't worth it, but I think it was worth it. It was worth it to go to an academy, to a training school. I mean, the dreams that they sell to you, the advertisement that they say like we're going to support you from the start to the end, and that's not true. And I can tell you that that is not true. At the end, I was abandoned, and I was abandoned ugly, and it's very difficult to get your CDA. And yes, I am frustrated. I am very frustrated and disappointed. I'm sorry. No, Marie, those are very valid feelings. I'm sorry that you're feeling that way. Something that I would like to repeat is that the work that we are reporting on today also talks about the state level efforts so that people like you and like Millie who are taking care of children, but you're not asking for money to those parents, so that you can have access to those statewide payments and to be equitable pay, dignifying pay. This is what we're trying to elevate from this report. This is something that is happening through the different organizations and through you as well. And I'm sorry that you're feeling this way, really. But I hope that we can show you and that your effort is not in vain and that you can see that we're really daily working on these. We're not exaggerating. Daily, we're working to get people like you and Millie to have the same access to dignified pay in the state. And thank you for sharing. I see. Do we have time to
Let's
hear from
do
Estefania and Nicole?
let's do that. And I know there are things in the chat as well, which we can try to follow up one-on-one with your questions as we can. And also want to invite those of you, if we didn't have a chance to get to your questions and feedback, like I said, we truly want to continue the conversation. So you'll have my email and we'll make sure you connect to the person you want to talk with. Okay, but Estefania?
Hi, good afternoon. Thank you for the opportunity for me to be here today. I just wanted to make a comment regarding what other people are commenting. I'm also an FFN. I am a mother. I am Latina. And right now, I am a single mom. Thank God I have counted with the opportunity to be able to work as an FFN. It's something that has always been clear to me from the moment I started is that I care for children and the work that I do is it's a job and that's why I ask for pay. The women that I care their children for, they're these are women just like me. They're Latinas, they're immigrants, perhaps they don't have a immigration, a definite, a settled immigration status, but they value the work that I do at, while I take care of their children. I don't ask them as much money as a childcare center, of course, because I don't have a license. But I do give a value to the work that I do because I also need that. And I also wanted to comment regarding the statewide parent coalition. I also took the PASO program. And at that point, I couldn't take the CDA because of financial reasons. But this year, we got a scholarship to like the graduates from last year, we got a scholarship so that we could do it for free. So I want to share to other FFNs who are here where they're saying that they're not asking for money for their work. Your work is valuable. And just like we are providing care to the children, the mothers should also need to be aware that what we are doing is not for free. Thank you. Yes, totally, Stephania. Thank you for sharing. And thank you for those tips for all of our colleagues. Nicole.
Hi, I just wanted to get, I guess, a little bit more clarification on the Good Food Program, and how, early childhood counselors can get more involved in either sharing these resources, getting the FFNs connected, because I think is a great program, or if there's any more grants available that counselors can help with somehow. And then I was also curious, does this help cover for like gardening curriculum as well, or is it just specifically like, reimbursement maybe for food, or how does this all work?
Nicole, I think there were a few layers there, and I'm not sure I caught all of them, but I think you're really interested in Good Food Collective, which has done some really interesting work around food access and family, friend, and neighbor care. The work that we're highlighting in the case study, which you can find online right after this presentation, we'll talk more about their emphasis on really how their interest in listening to the community about how to meet food security needs really led them to focus on childcare. So please check out all of Good Food Collective's work. It's amazing, but you'll see that our emphasis is more focused on their advocacy efforts. And then I think you were also looking at how to connect to resources. This is something that we will be having more conversations about over the next few months. And so please complete the survey at the end of our presentation today to find out more ways to be connected. Thanks for your question. Yoni, do you think we still have time to do a couple quick questions? Which ones did you want to pull forward?
There were just some quick highlight questions in the chat. Someone, I believe it was Nathan, asked about how the adaptation of the CSPC's PASO program was possible. And then there was also just a quick question that was about what counties this information came from. I think, I'm sorry, I'm probably not pronouncing it right. Soira from the Early Childhood Network had a quick question about just representation, I think, of geographically.
So I'll take the first one or the last one first, and then co-researchers who worked on statewide on Weld County. If you have a response for the first question about the adaptation, that would be great. But we intentionally, Angeles mentioned that we set up different criteria for the selection of bright spots. Again, this is not an award. This is a representation of good work that's happening around the state. And we intentionally selected communities that work in very different environments. And so you'll see in the case studies, each of them talks about the geographic area served. And so in each site, we spoke with caregivers from those different counties. But we have representation certainly from the metro area, from Greeley down into different parts of Denver and Aurora, and then the Eastern Plains, and then far south, Southwest Colorado and Durango. Does anyone on the team have a brief response around the question of adaptation for the PASO program? And if not, we can follow up and connect you with Weld County. I think that'll be one we might best do by connecting the question with the site.
Could I
Okay.
just add something there,
Yeah.
real quick, Hillary? I think that question is a natural one for any of the good things that we're highlighting. How do we do more of this here? How do we get this over into this county? Those are questions that we're sort of wrapping our arms around with right now. Okay, what does sort of the next evolution of this work look like? How do we get more and more bright spots to exist in more places throughout the state of Colorado? As Hillary mentioned, there are several more bright spots that we didn't highlight, but there are also communities that have very little outreach or no outreach and supports for FFN providers in those communities. So how do we get maybe more PASO programs into other communities, or just other good work that is happening? How do we potentially inspire other communities as well? So it's a great question, and we are wrapping our arms around, okay, what does that mean for the next phase of this work?
Thanks, Miguel. Olivia, I see your hand.
Thank you, Hilary. I just wanted to answer real quickly to the person who asked the question that we don't know exactly the step-by-step process to implement the program in other communities. But what I'm sure about is that here in Weld County, speaking with Lorena Ruiz, who is the coordinator, she says that they're even going to expand it more, and they're going to be able to provide it in Fort Lupton this year. So it is growing because there is a huge need for the providers to get the training. Thank you.
All right. We actually have a couple of slides that we really want to share with you because in part, it feels like some of the most important work that we learned about throughout this process. And that is really the ways that the different sites we worked with are shifting the narrative or the ways we talk and think as communities about family, friend, and neighbor care. And we want to share some of those observations that we made that help us think about FFN care as a very valuable and essential community asset instead of just an informal fallback option. So Nabila, this is your moment to come back on and share a couple of those shifts with the group.
Thank you, Hilary. Now I will present with Christy, my colleague Christy, about the section of changing the narrative. We have 4 reframes. I'm gonna take the first two, and she's gonna take the rest of it. So if we look at the first one, there's two stories. There's old story and the new story. I'm gonna read the old story. So the child care is a concern and research relevant only for or to parents of younger children. What I want to say here, it's responding to the new story. It's an invitation to rethink child care as an issue for only for families and the small children. In reality, everyone in a community benefit from quality childcare, and everyone should invest in it. We are interconnected, and we benefit from quality childcare, which means in the past they thought it's only for the parents who have a younger children. But on the other hand, no, it's for the community. Everyone in the community will benefit from it. Can we move to frame two? Frame two, all the study, only licensed providers can offer safe, high quality childcare. But we need people to know about licensed, exempt childcare providers and to trust them. We will care for the children with love, honesty, and care. From my experience, for myself, I want everyone to know about how I work hard to care about the children who are under my supervision, under my care all the days. From my heart, I do that work. I am a grandma for 7 grandkids. Beside them, I have another 4 kids that they come to my house every day. They love me, I love them. They will when their moms come to pick them up, they will ask them to go. They don't want to leave. It's a lovely time for me when I hear that from them. And they know it. They know I love them. They love me. So hopefully parents can trust us and look for the FFN provider to take care of their children. Thank you. It's for Christina.
And Christy, just before you go, I know a lot of our participants are having to jump off, and I just want to invite Yoni to put the survey link in the chat. So in case you have to leave abruptly, you have it and you can still find ways to get more connected. Okay. Sorry to interrupt there, Christy. Please go on. We have time.
That's all right. Thanks, Hillary. Yeah, so, we know that we should not only be focused on licensed caregivers, but really focused on all caregivers, including FFNs. We must shift and recognize how FFNs also need to have learning opportunities and access to additional resources. It improves the outcome to how we support children and families in care in our communities. And that's our bottom line, I think, for everyone who came together. Next slide, please. Thank you. And lastly, we must invite all folks to the table. We are stronger together and can be a leading example of embracing diversity. Not only does this help better shape policies and programs, it helps support the children and families in our communities. We talked earlier and often about building trust, and this is a key piece of that. When folks are well represented, we're stronger. We're going to build that trust in our community, and it's not going to be quick or easy. And I know we touched on that earlier too, but it's worth it, and we must persevere. Thank you.
Thank you, Christy. All right, everyone. You have the survey link, and we hope that you use it. We want you to know that Donald K. Foundation is really committed to family, friend, and neighbor care supports in across Colorado. Through the Bright Spots report, and other opportunities. So if you're not already signed up for their newsletter, please do that, and you'll stay connected to many things that are happening to support family, friend, and neighbor care. I'm also really happy to share that we will be continuing to have conversations and really working with community groups who want to do more to support family, friend, and neighbor caregivers in the months ahead. And if that's a conversation you want to be a part of and connected to, please complete the survey and share your information. You can also share with us in that survey other people you think we might want to talk to. And you'll see my contact information at the end of the report as well, or the slides, so you can just reach out to me directly. And with that, I think I'll pass it back to Miguel in case there's any last words you want to say.
Wonderful. Yes. Thank you, Hillary. Thank you to the entire team for being a part of this project and presenting here today. Thank you especially to our FFN leaders who guided and shaped this project and who are presenting here today. So wherever you're at, if you want to wave your hands, give a clap of applause, shake your fists in the air, we want to thank and support our FFN providers who, in addition to the children that they're caring for right now, have dedicated their time to this project. I know we had some hands that were still up. Andrea, I don't know if you are done at 1 o'clock, but I was going to put the invitation. We can stay on for 5 extra minutes. I can, or 5-10 minutes if anyone wants to ask additional questions. But Andrea, I don't know if you need to leave.
I'm good, Miguel.
Okay, well, thank you all. It is 1 o'clock. We can end here officially. But if anyone wants to stay and has any additional questions, Roya Brown, I've seen your hand up and would love to call on you. Dr. Anissa, I saw your hand up earlier and I don't know if you have to leave. But yeah, I'm happy to stay. And if anyone wants to stay, you're welcome to. Thank you all for joining us today. We appreciate you all. Roya.
Just a second. Okay, hello everyone. I am with UB Early Learning. We are mobile preschools in Aurora. We have 4 units of mobile preschools and we are FFN. One thing that we are very, almost all of us are teachers, and we have a holistic education program that we are teaching our kids. 3 hours each class per day. And recently, we decided to offer, we noticed that many FFNs, they are not, they don't have access to the curriculum. And we want to offer our holistic education support program free to kind of mentor these FFN to offer quality emergent curriculum for their kids. So I put my flyers, the 1-page flyers in the chat, and we have talked to the Office of FFN State of Colorado, and they really love our offering. And this is our pilot program, and we want to try it for 1 year. And we have money right now to offer this for free. And that's it. That's I wanted to put it out there, and I'm going to put my email address in the chat if you'd like to contact me, and I can provide you with more marketing materials, and also we can have a Zoom meetings to provide PowerPoint presentations. Also, we do these programming, this mentorship and support both in person and also online. And we do it also in English, in Spanish, and Dari, 3 languages, that we offer this holistic education curriculum support. So I put my email there, and that's it. If anybody has questions, please let me know.
Thank you, Roya. Appreciate that. And yes, please, everyone, check the chat. There's links there, and Roya's email is in there as well. Dr. Anisa.
Hello, everyone. Thank you very much for this great presentations about the highlight of the spotlight, for the bright spot for the organizations that serve the FFNs. So I would like to comment on one thing from my own experience as a support for the FFNs. So I was like part of the ECG when we had the program last year, and we were part of the Bright Spot, and also now we are still doing the work with ECG and Denver Early Childhood Council to support the FFNs. So I would like to highlight one thing. There are two layers. The first one is that reaching the FFN themselves and making them aware of what's available around them. We would like them to know these are the resources. And there's another layer when they reach these resources, what is their pathway? Would they like to continue as an FFN, support parents, children, and provide the high quality care? And this is like the payment, the money, and which is logical. We have to think of it. So this is like the part where I feel like there's more that we can do on the layer where, yes, now they are ready, because I was so happy when I heard about, yes, now I have my CDA. CDAs, it's a great accomplishment. When you have this means that you have knowledge about child development. Yes, great. It's like when you get a doctorate or whatever. I mean, like whatever accomplishment you have, and you feel like, I'm not able to use it. So I think there is a part that we have to think of. How can we open a pathway for people, for FFNs, when they want to go to that side, how they charge, on how they marketing themselves and skills and childcare, if they want to go and ask for the support from the state. We know that the CCAP, and we know the long story about it. Hopefully there's a time that when it's gonna be over and come back. But even with the exempt provider payment, it's still not enough.
Yeah.
It's half of what the fully licensed childcare provider in the center. And this is what makes us know we are doing the effort, all this great effort that we hear today, and the state is providing them. This is what makes us learn when people come and say, hey, I made this effort and I got that and I worked with that, and this is how how can I improve more? So I appreciate all these stories, and even I don't see that it's something was wasting time when you sit and take a training and you feel like I'm not using it, or this certificate or this degree or whatever step you want to take towards your professional development, because this is what we are waving now. We are trying to learn more how to make it align. The effort that you do for your professional development is going to be like a reward for your income. And I think this is the piece of it. We should not be discouraged. If I made all this effort and now I'm not, it's a step everybody here in this call is trying to reach. How can we? I don't want to make it long, but just it touched me when I hear that. But it's happened to everyone in any field. But what happens now, just we are trying to learn more. How can we make the regulations more support of FFN? How can we make even the outreach? FFN, not everyone knows that they are an FFN. During the outreach, we're having a stage where we are making them know that they are an FFN and there are resources that can help them. So it's more of effort of a prep stage that needs to be done to reach people. Like now, if we didn't hear that, some people say that I did all this time and so we want to have more time, more work to reach to more people, and all these, like the providing programs in whatever way that is convenient to the community. And I want to take this opportunity to thank everyone who is in this call for all this great work. Yeah, thank you.
Thank you. Thank you, Dr. Anisa. Appreciate your words. Well, again, if anyone has anything, I can stay on a little longer. I also recognize that we have FFN providers here who are taking care of children. And if any of you need to leave to take care of the families that you're taking care of, the children you're taking care of, please feel free to jump off. But any other comments, any other questions from anyone? All right, let's go ahead and end it there. We will send the recording out to everyone as well as any additional information like the presentation slides. We'll make sure to get these out to everybody. Christina Herman from the Colorado Department of Early Childhood is here as well. Thank you for joining us, Christina, and for promoting the event here as well. Really do appreciate you know, putting in the effort to get the word out. So, but again, thank you all. Any other final comments from anyone? Okay, that's a wrap. Thank you all. You all are amazing. Appreciate you.